Hi everyone, I'm Ray from BSMT-5. Let's talk about the effects of drugs and alcohol to seafarers in a relation to sexually transmitted diseases or infection and how it can be prevented. So first of all, what is drug? A drug is any substance that alters the function of mind or body. How can I tell if there is a drug problem on a board? There are no social or class division of drug users. They may be found in all walks of life and at all social levels. The physical characteristic of drug addicts depend on the type of drug use and the time that has elapsed since the last dose. The drug user generally develops an ability to lie about their habit and keep it secret. Crew members may not notice a drug user among their colleagues in a close community such as ship's crew. There may be a strong bond of group loyalty, which may result in an unwillingness to believe the worst about a colleague. The only way of establishing with any degree of certainty whether there is a drugs problem on board your vessel is to embark on a drug testing program. However, there are a number of other indicators which might help identify those with a drug problem. These are sudden unexplained mood changes, unusual irritability and aggression, abnormal changes in concentration, and poor job performance. Dealing with and preventing the use of drugs on board. To try and mitigate against the use of drugs on board, you should devise and implement a written policy on drugs, implement a prevention and education program to provide the seafarer with clear factual information about the nature of drugs. Facilitate social interaction on board by means of interactive group recreational facilities. Sexually transmitted infection including HIV and AIDS. The magnitude of HIV and AIDS differs across the countries with the HIV epidemic having seemingly reached its peak in the African region. There are large numbers of AIDS-related orphans in Zambia and Kenya, and many children in Zambia and Romania have AIDS. In Zambia and Romania, mother-to-child transmission is so high. So, is HIV mortality among adults? The heterosexual route is generally the predominant route of HIV transmission in project sites. And this is an example of protecting yourself and others. You can greatly reduce your risk of getting sexually transmitted infection by practicing safer sex. Some STI such as genital warts, herpes, and syphilis can be spread through contact with infected skin that is not covered by condoms or other barriers. Here are some tips for protecting yourself. Use a condom for vaginal and anal sex or a plastic condom if you are sensitive to latex. The internal or female condom can also prevent many sexually transmitted infections. Use latex or plastic barrier such as a dental dam or plastic wrap for oral sex on a woman or for oral anal sex. And know that some methods of birth control such as birth control pills, shots, implants, or diaphragm will not protect you for sexually transmitted infection. That's all. Thank you.